My name is Carrie Neerland, and I'm Region 5 representative for the American College of Nurse-Midwives. I have been a midwife for 19 years. I came to midwifery because I felt very strongly about reproductive justice and about women's health, and I went to nursing school to become a nurse midwife and then went on to become a midwife. And it was when I was a student midwife that I learned about ACNM from the director of my midwifery program and was encouraged to start taking an active part in our local chapter. And so I attended meetings, and it was also at that time I learned that they had scholarships available to attend the National ACNM conference. And so I applied for that scholarship, and I went to Washington, D.C. To take part in the annual meeting. And while we were there, that was my first annual conference, I was so empowered, and it was so inspiring to see the leaders and the scholars. I was reading their papers, I was reading their textbooks, and to be with them in those spaces was very, very exciting. And I thought, maybe someday I can be like that. And so after graduating midwifery school, I went back to my chapter and continued to be involved. And so as an early midwife, I became a treasurer in my chapter, which eventually became an affiliate. And from there, I continued to get leadership experience and support from other midwives. Then I became a co-president of my affiliate, and then I was encouraged to then get involved on a national level. Becoming a region rep and being able to serve on the board of directors is really important because it makes that connection between those midwives who are doing the clinical work, day to day, caring for patients, and being that voice, but also working in committees. I can communicate with them what's happening on the board, as well as communicate to the board all of the important things that are happening in our affiliates and in the volunteer structure. ACNM has been instrumental in all aspects of my professional career, including my practice, my scholarship, my leadership, the opportunities to be a leader, the mentorship that I have received from other people in the college has been amazing and supportive. ACNM has provided the founding documents that support my practice. Things that ACNM produces, like position statements and clinical guidelines, are also so important. They help to guide the practice of midwifery. In terms of scholarship, ACNM has been really important for me to be able to have the opportunity to disseminate my research. ACNM, through the annual meeting, provides a platform for me to get my research out there, to be able to share it with other midwives. And one of the just greatest times that I think we have together is at the annual meeting on the dance floor. I think is really important about ACNM, the joy that it brings us as midwives. It's just a really awesome time, and midwives like to have a lot of fun.